Hello, everyone, and welcome to the Black Health Trust information meeting for family safety during the COVID-19 pandemic. I'll turn the meeting over to Dr. Maxey.
Before you do, we're at 11, 12 people. We're expecting a few more. And I'm going to call one of the speakers who is not yet on, and then we could start right after that, if that's okay.
Yes, yes.
I don't see Dr. Bailey on, that's who I'm about to call.
Rerun the whatever it was that version. I thought I already had it working, but I see I'm on.
I see you now.
The delay.
Okay, I see you now. So you need to mute one of your devices. And is Kim Simmons on?
I'm on.
Hi, Kim Simmons.
Hello, Mr. Bailey. Dr. Bailey?
Absolutely, good to see you.
Good to see you too. How are you?
Fine, hope you're doing good. Hope I'm only on one device, so it shouldn't be my volume, you think?
You sound good now.
Can I be heard now?
Yes, sir.
Okay, very good. We have an outstanding program today. And there are a lot of things happening in our environment, in our country. And I want to start just with a short statement before I get to our speakers for today.
Dr. Maxey, can I just pause you for a minute? So we're getting you through your iPad, and so your picture isn't showing up. And so I don't know if there's a way that you could turn the camera on the iPad and yeah, there we go, because we're not getting you. We got to get you. Okay, now if you gotta censor it to move yourself up, you know.
Okay, I'm good.
No, there we go. Okay, that's going down too low. Come back. Yeah, right there. That's good. You can keep it. I don't know if you can keep it like that.
Okay.
Okay, cool.
All right. We have a lot of things going on in the environment, in the world, and specifically in our nation. And a number of us have a lot of concerns about the health of people of color, specifically African Americans, Latinos. In previous calls on Sunday, which was originally developed to make sure that our communities knew how to protect themselves, how to increase their immune systems against COVID-19. We've talked about the various clinical issues regarding cleanliness, washing hands, avoiding infection, what to eat. What we want to deal with today has a lot to do with mental health, the anxiety, our response. And we would be remiss if we didn't also look at the larger context of what's going on health-wise. Many of us believe that racism is a public health crisis. And we know that it's often been described as a form of post-traumatic shock, which can incapacitate you emotionally, mentally, and even your immunologic system. We are concerned that much of the misinformation that's going out from agencies, some private, some of the government, misinformation being placed in our barbershops, beauty shops, and communities, telling people that they do not have to protect themselves from this COVID-19. They don't have to wear masks. They don't have to be concerned. It's all a hoax. So we established this call to try to give credible information that has been vetted. At the same time, we know that information has been changing week to week as we learn more about this virus, which is mostly new, and we don't know all of the real physiologic effects of it. We don't know all of the genetic and epigenetic issues around this virus. But we do know that we need to have some rational way of approaching this in defense of our families and our homes and our children. We know that the cities are now opening up to business. And we know that some of us are what I call the tip of the spear, that we're the ones who have to clean the rooms, take care of the sick patients in the hospital, work in the grocery stores. We have many of the low-paying jobs. Those of us who are healthcare professionals have to expose ourselves to potentially carriers of the disease, which we may not know because there's not adequate testing. People who have the disease and we don't have the appropriate personal protection equipment. And we know that it has not been made available to our communities. At the same time, I can guarantee you that there are warehouses full of millions and millions of these supplies in neighborhoods that aren't ours. And they're being made available to physicians of other ethnic persuasions. I know that for a fact. I know the fact that the government has not made these supplies and these protections readily available to even the frontline workers and those of us who practice in the so-called hood. So I have a concern. But today our topic brings together three distinguished professionals. I will mention them briefly. I will have them introduce themselves. They're going to be asked to speak 5 to 6 minutes and entertain questions and discussions. I would appreciate it very much if we exercised diligence on being polite. If you want to speak, there's a place on the bottom of your screen where you can raise your hand and wait to be recognized. Don't just blurt out an issue. It is very important to listen to the speakers and to give everybody a chance to get in. We'll try to make sure everybody gets to speak. And I want you to speak in sound bites, not speeches, but limit your responses for those other than the speakers to 30 seconds so we can get through the call and have time at the end for even more information. I want to introduce Dr. Ron K. Bailey, who is a psychiatrist, who is the former president of the National Medical Association, who is the chair of the board of the Cobb Institute, and who is currently an assistant dean of the College of Medicine at Drew University and chief medical officer of Kedron Medical Center. I would also like to introduce Ms. Kim Simmons, who has a master's in psychology, and she is a licensed marriage and family counselor. She's a graduate of Pepperdine University, and she is in private practice in Los Angeles, California. And in full disclosure, she happens to be related to me. I won't tell you how. And then lastly, I'd like to introduce Dr. Emmett Cooper. Dr. Emmett Cooper got his MD degree at Howard University College of Medicine. He also obtained a PhD in pharmacology. He's a practicing psychiatrist in the city of Cincinnati, Ohio. And he is formerly the director of mental health for the city of Cincinnati, and currently is the CEO of the Total Health Experience, his practice in Cincinnati, Ohio. And I can tell you, when he graduated, he was a top graduate of his class. He had a 4.0. I don't know how he did that. I didn't come close to that. And he happened to be one of the smartest physicians I've ever met. So with that, I'm going to ask Dr. Ron K. Bailey to address us with his thoughts. Dr. Bailey.
Yes, well, thank you very much, Dr. Maxey, and certainly appreciate the opportunity to join the group. And I'll keep my comments to 5 or 6 minutes. And we're all learning the Zoom model these days. Many of these type activities, I find them to be very, very beneficial. I've kind of jotted down a few points to kind of go through that I think are particularly key for those who consider the psychological implications of such. First, I think that the issue of education is key. People need to understand what the virus means, what a pandemic means, why the risks are higher. I heard the governor of New York saying on yesterday that early on there was misinformation about whether this would be less than the flu. The flu doesn't kill 100,000 people in this amount of time period. So quality education, means a great deal. And I think it should be repetitive and ongoing. And I love your earlier comments, Dr. Max, it should come from trusted sources. All too often, people in our community don't trust the sources that give information for rightful reasons. And that goes back to a long history of mistrust and mistreatment in these settings. So we have to get adequate and optimal information out, I think, to our communities, give them a chance, I think, to feel comfortable and to survive, I think, in this venue. Next point I mentioned, I think, is a classic issue for psychiatry and psychology. And that's the issue of fear. Fear, unfortunately, drives behavior, but very often in a negativistic type fashion in ways that are actually much more likely to hurt and harm than otherwise. That's what I think we're likely to see here. The fear, which can be exacerbated by misinformation, made the point regarding adverse comments, I think, in a barbershop, flyers that say you don't have to use masks or gloves are very harmful and very often, I think, targeted to communities that may be a lot more likely to believe in it because of pre-existing fears in this regard. We've got to address that. We've got to modify that because an ongoing fear in our community, our society, is likely to lead to more adverse outcome and more inherent risk. I think a third piece is that in psychiatry in general, the consideration regarding stress, or the stress diathesis, we call it, is huge. And I think that's likely to lead, I think, to the changes not being followed regularly, whether it's staying in and self-quarantining, whether it's optimally and regularly using all of the so-called PPE outside the home, gowns and gloves and masks, but also disinfectants inside, and being very much more, I think, acutely aware of the need to be hypervigilant in our ability to disinfect surfaces and clothing or what have you. All these issues that I think we've discussed in psychiatry for some time, very often because of the stigma against psychiatry, and mental health issues, and the stigma against those of us who work in this profession, I think very often as a question about whether I think our patients and our society members will follow those recommendations, I think in an ongoing type of fashion. It's essential, I think in this case of the COVID-19 pandemic, that persons do so because the risk can be remarkably high. I think it's also key that the particular long-term health implications are monumentally important here. Very often African-American persons, especially men, have been at a higher risk of these so-called chronic medical illnesses, hypertension, diabetes, asthma, even cancer, more so than they should have been always, more so because of a lack of prevention previously, and more so I think was a lack of optimal access and care, less Obamacare or ACA, less Medicaid expansion in southern states. All these I think have been policy-based and governmental interventions or lack thereof that have allowed for this long-term chronicity of chronic medical illnesses to be really an ongoing albatross around the necks of many middle-aged men in our community. And now that the pandemic has come into place, those are particularly the groups that seem to be at the highest unfortunate risk of early mortality and or death. All huge issues that I think address concerns regarding safety, concerns regarding fear, and concerns regarding how we're going to educate and inform our communities in a way that comes from trusted sources to change and modify their behavior effectively kind of going forward. I'll kind of end this 5-minute piece by saying there are a lot of things we can actually do, and we'll discuss a lot more of that, I'm sure, during the question and answer. We're encouraging persons to use their home period advantageously and not see it as a punishment or something that's a deterrent from their normal activities, whether they're getting more exercise, whether they're enjoying and engaging in better family activities, having dinner with their family, not just kind of retreating to their rooms and playing on their video games and things of that nature for teenagers, whether they're finding ways to have a multi-generational family construct, having grandma and family and children in the same course for a time period. Maybe this will strengthen the kind of bonds we've historically needed, I think, to maximize and optimize family engagement, but also to, I think, strengthen the likelihood of follow rules regarding safety and better overall self-care. I'll stop with that. Thank you very much for having me today. I'll wait to hear the other speakers' comments and definitely enjoy taking some questions and answers at the end.
Thank you very much, Dr. Bailey. Kim Simmons, please give us your thoughts.
Good afternoon, everyone. So I just wanted to take a little bit of time to talk about sort of the confluence of this COVID-19 crisis alongside now the riots and the racial trauma that the country is experiencing as a whole. And something that Dr. Bailey said stuck with me in terms of the fear and the anxiety, right? So just to define a little further, fear is the emotional reaction to something that is threatening right now. There's a threat right in front of you. And then the anxiety is the fear of things that are to come, that aren't exactly in front of you right now. And so there's the fear and there's the anxiety, and it's growing and it's growing. It's been growing just in this year alone over several months. But then if we look back, this is with this new racial trauma that we're experiencing, it is a re-traumatization. It is repeated. And it makes me think really hard about intergenerational trauma and how it impacts our communities of color. And because I am a therapist and I'm on the ground, actually, I'm right now focused more on training therapists who are working with our poorest communities. What do we do for those people to get them through this in the best way possible? So there's things that we do. African Americans, I was reading up on this weekend. There's a woman by the name of Monica Williams, and she's out of the University of Ottawa. And she talks about things that we normally do even before an incident occurs. We tend to reserve judgment, right? This is to help us maintain self-control. We tend to reserve judgment. We reappraise the way we think about other people, hopefully to make it more positive so that we can maintain our self-control. We make efforts to avoid impulsive reactions. We offer information about ourselves. We offer information about ourselves in order to help people understand us, to reduce the likelihood of incidents and misunderstanding and negative stereotypes as well. We also seek out information about other people in an effort to hopefully change our minds about them, to reduce, again, this interventional anxiety, right? That fear that something is to come. It's important that with COVID-19, with this new racial trauma that we're experiencing, that we figure out ways to get to people, to encourage us to help ourselves, and finding ways to do that effectively. So how do we get people to take on mindfulness? How do we get people to really take seriously the suggestions to exercise, the suggestions to get out in nature and go walk by the ocean, go walk in the hills and mountains? How do we get people to really take that on? And I think something that might be really important in times to come is, how do we identify those folks that are in the community that have taken these coping mechanisms on, to speak more loudly to people that are more likely to hear them, rather than to listen to what the government has to say, what the doctor who doesn't look like them has to say, what the doctors who do look like them have to say, quite frankly, because sometimes they don't feel equal. And so they don't want to hear. So I encourage everybody on this phone call. I think you guys, we are like the perfect sort of starting point to start banging on your drums about self-care, and the need to nurture ourselves, our minds, and our bodies, so that more of us will hear it and that we can be okay as a people. And I'm going to stop there. And thank you, Dr. Maxey, for this opportunity.
Thank you very much, Ms. Simmons. Dr. Emmett Cooper. Dr. Cooper, can you hear?
Gotta unmute.
Dr. Cooper, you need to unmute yourself.
Let's see.
There you
Can you hear me?
Yes.
Yes.
Can you hear me?
Yes, we
We
can,
can,
Dr.
yeah.
Cooper.
Okay. Okay. So did you catch any of my initial statements or not?
No,
No.
sir.
Okay, good. All right.
And if you could stay right where you are, move back a little bit so we can see your full face. Excellent.
Okay.
Thank you.
Okay. I'd like to say good morning to the group, and thank Dr. Maxey for giving me the opportunity to participate in this technological exchange of ideas and information. You know, we're going through some difficult times, and as Dr. Simmons and Dr. Bailey both pointed out, it's kind of been a confluence of traumas, with the COVID virus, with police brutality, with the malevolent figure we have in the White House, and an assortment of other things. But if a community or society is going to survive and thrive, it requires that they have the ability to adapt and adapt quickly to whatever existential demands exist. And so I was trying to determine what I was going to talk about in 5 minutes. And it's hard to explore any one topic in that amount of time. So I fell back on my practice, and I tried to look at what do I really try to teach my clients at my office, where we cover both all three primary care, substance abuse, and psychiatric care. And basically what we try to teach them is how to make decisions about their own well-being. And so I think if we apply that to life in general, we have to make decisions on a daily basis to a number of existential issues and demands. And if we don't have the proper process for making those decisions, we often do things and self-instruct ourselves to do things that are ineffective and at times unhealthy. And you can apply that to preventive care of medicine. You can apply that to someone who might be overweight or has high blood pressure or involved in substance abuse or who has difficult times getting along with people. And what it, in my opinion, what it comes down to is the tendency for people to make decisions based on their emotions. And since their emotions are subjective interpretations of events, that subjectivity will distort what's really happening. And I think to the extent you can teach people to respond to life or process life the way it is and not the way they think it should be, the more likely they are to be able to make decisions that are effective and healthy. So I thought I would just go over briefly some of my thoughts, mostly based on having practiced psychiatry for 45 years and run a methadone Suboxone program for Suboxone for 20 and methadone for 40. And dealing with an integrated healthcare system that provides primary healthcare and mental health as well. Because it's beyond the, I think, scope of this presentation to discuss the societal changes that we need to occur to address all the problems. So if we can at least make the individual more effective, then hopefully they could coalesce and become a more effective community and a more effective society. The basic issue that I see is that people tend to abdicate responsibility for what they do when they become emotional. And if they're under stress or if they get depressed, and Lord knows, given the situation of loss of jobs and 100,000 people dying and being at home for extended periods of time, what do you do after you watch all the Netflix movies? I mean, you kick the dog or worse. We have seen increases in drug abuse and overdoses and things in our program. And so, what we try to do is teach the person that their behavior and their motivation should not be based on how they're feeling. It should be based on what their vision is of the people they want to be and the society they want to live in. Too often people will say, well, I'm not motivated to do something, as if that were some kind of feeling that they would get from drinking some sort of elixir. Motivation is too elusive a notion to allow that to drive your behavior. I think what should replace that feeling, if you will, is a vision and discipline, because that's under your control. If you don't know where you're going, any road will get you there. But if you have a sense of where you're going, no matter what comes at you, you can train yourself to take a deep breath, describe what is really happening, not judge what you think should be happening, and then assess what your options are for addressing those situations. I've had a lot of people come in lately with a lot of domestic violence issues because they got what they wished for. They were wishing they could be home and spend time with the family, and they got what they wished for. And unfortunately, it was not quite what they expected. And we've seen increased battery to children and spouses, as well as the alcohol and drugs. If I have to leave you with a thought, it's that in life, we have no choice over whether we change. We're going to change every day that we live. The choice we have is what we change into, and we're going to change into whatever we practice. And so rather than allowing that to be practice just responding to things, I want people to develop a vision of the person they want to be, the society they want to live in. And every time they have a choice to make, rather than basing their decision on how they feel, say, if I were the person I say I want to be, or if I were a part of a society I want to be a part of, how would I respond to this situation? I think that's a much healthier way to approach it. It empowers you to take some responsibility for outcome. And in the end, it develops allies as opposed to adversaries and those that we deal with. So I'm going to stop right there for the time being. And again, it's a difficult topic to talk for 5 minutes on. But again, I think you are more likely to resolve issues and address problems appropriately when you can process it the way that it is and not the way you think it should be. So I'll stop right there and wait for questions if there are any.
Thank you, Dr. Cooper. I'm going to ask the first question. In the meantime, I'd like Mr. Ross Jones. There's a young lady he has that does want to ask the question right after I finish. But for each of the speakers, if you could list several key items that would help us survive. I understand the first law of biological imperative is that you survive. And from the standpoint of your respective disciplines, I would like you to comment on what areas we need to look at to survive not only the pandemic and the epidemic that is going on in Black and brown health every day. But I recall today is the anniversary, if I'm not mistaken, of the massacre that happened in Oklahoma of the so-called Black Wall Street. Dr. Bailey? I think you need to unmute.
Must automatically mute. Clearly, I think that the historical context means a great deal to me and to others. I'm in the midst of this weekend of kind of writing position statement for both the APA and the NMA. I talked to Oliver Brooks, our president, about the NMA's statement that came out on Wednesday. APA put one out on Friday with a focus on the fact that historically, when we've had these kinds of complications, many have struggled whether or not we actually got the kind of results we were interested in producing press statements and speaking out against not only police brutality, but discriminatory bias and violence against communities in any form or fashion. My thoughts now are, what can we do to forward that agenda? How can we do this better? How can we get, I think, some better, more enhanced outcomes? Violence is by definition a psychiatric concern, and psychiatrists, whether we're African American or otherwise, about 1,500 of the 38,000 psychiatrists in the country are African American. We need to have a voice and a role to play, I think, in this endeavor. Clearly, I think not only addressing the issue of violence, but addressing the antecedents, where does it come from? And it is about racism in many regards, discriminatory bias, mistreatment of those persons who are vulnerable, underserved, and very often underrepresented populations has been a long history, not only in our country, but maybe I think globally, and we've got to hear about that. So I was happy to see on the news today that there are marches not only in Los Angeles, where I am right now, and New York and Atlanta. There are marches in London argued against this brutality, because the reality is where it exists in one place creates vulnerability, I think, to others as well. Worse though in the US, much worse, I think, in communities where the police have an antagonistic relationship, I think, toward the people that they should be serving, particularly worse in settings where the government indirectly supports it. Many forget that in the last 2 or 3 decades, the government has actually, at the federal level, militarized what should be law enforcement or police by selling them at very low prices, old military equipment. So you have a militarization, I think, of your law enforcement, which should be a peacekeeping force, and very often has to be an identified target, and all too often those are African American males. It's a volatile cocktail, and it's worked against, I think, the health and safety of Black men here for some time, and it's been an old repetitive message. So we've got to, I think, understand the history here and find ways, I think, to address it in a more effective way. I believe in collaboration. I think, in the political process, but I also think that as professionals, we must be much more active and determined to our voice and not let this tend to go away, as so many others have, with a lot of discussion up front, and a week or 10 days later, we move to the next part of the media cycle. There's got to be something different this time, Dr. Maxine, and we've got, I think, be engaged and diligent in our approach.
Dr. Maxey, you have to unmute yourself. Or
Ms. Simmons?
You better know.
Yes,
Ms.
sir. Good afternoon.
Do you have any comments to make regarding the things you might suggest from a mental health standpoint we need to take into account?
Sure. And just something that came, if I can interject a question or a statement about Mr. Bailey's point. about what about task force and oversight committees within the police department, within the mayor's office that help to monitor and bring accountability to the police, to the government agencies that are abusing their power? Where are these agencies? I mean, where are these committees and these task force and these people of color that can represent people of color? I guess as a layman, as a citizen, that's my question. Now, why is it just 0 to 60? There doesn't seem to be any intermediate, people in between kind of holding anybody accountable. So that just was on my heart when you called my name, and I said, okay, well, I'm gonna say this. So that's my question I ask. And how many more task force can we form? Who can join them? How does the public, because for me, the anxiety that I feel and the desperation that I feel, and as a mother of 2 Black men, young men, I am not a little, but I'm very anxious, and not just for the first time. It's an accumulation, like Kim was talking about. It's accumulation of anxieties and feelings about helplessness. So my thought for my own mental is I'm trying to meditate, and I'm trying to turn to anything spiritual or otherwise that can help uplift the foot that I feel is on my heart, and the need that's on my heart. And I'm trying to cope with that. And I'm typically a very grounded person and very, somewhat stable in what I feel. My husband would probably disagree, but I think I'm stable for the most part. But lately I feel like I'm coming apart at the seams. And what can I do besides turning within? But I feel like if I don't do something, if I don't get my hands on doing something, it's making me feel crazy. Just to be honest with you, it's making me feel a little desperate.
I think your question is well placed. Ms. Simmons, do you have an initial response? Kim Simmons?
Unmute, Kimmy.
Kim Simmons?
Here we go. Can you guys hear me now? Thank
Yes.
you. So I think in a big nutshell, knowledge, right? And some of the things you're talking about are who to go to, where to go to, who to lead, who to listen to. But in addition to that, survival is going to include knowledge of self, knowledge of how you think, knowledge of how you feel, knowledge of what you want, knowledge of what you're looking for. Like Dr. Cooper said, you got to have a goal. You got to have a place out there where you're heading to. So a lot of learning, right? And learning. I'm gonna actually post into the chat some links that I found in terms of agencies that are engaged in social change, specifically with law enforcement. I'm going to throw that in there. Just it's about locating those agencies and finding out what those agencies might do and seeing how you can get involved, right? Looking for like-minded people to sometimes we need somebody to check us, right? Because our emotions, again, will run away with us and it'll lead us down a path we weren't initially trying to go down. So it's knowledge of self, it's knowledge of your community, knowing where you want to go so that when you find the people that you want to work with, you know that you're dealing with a like-minded crowd that can help you get there. So I'll throw those links in and then I'll end with that.
That's helpful. Thank you so much.
Dr. Cooper, in the context that you graduated from a medical school in the middle of a epidemic of revolution, and you were at one time in charge of all of the mental health for a large Midwestern city that is Republican and conservative in nature and famous for police brutality. How would you view the things and tools we need to do for survival, and in part answering the question put forth by Michelle, being a mother of 2 young Black men, and I know you have a family too. Can you address the issues of survival from your standpoint?
Okay, can you hear me?
Yes.
Can you hear me now?
Yes, we can.
Okay, yeah, yeah, I'm really not sure. I mean, I certainly share her concerns. It just seems to me that some things are beyond our control. I mean, if you look at the police department, they kind of are buddies with the prosecutors. And and they're policing themselves. I mean, so it's not surprising that they don't suffer the consequences of their actions in any predictable way. But I think they serve even a larger entity, the oligarchy that runs this country, who has a vested interest in keeping folks at each other's throats so they won't come together and realize that it's the oligarchy that's taking advantage of all of us and not, the white guy down the street who's making the same things you're making or maybe a little bit more. So I really can't answer that from a societal perspective. I don't know what the answer is. I know it's going to be a challenge and these things tend to happen in cycles, but I don't think there's the political will to really attack the power of people who control this country, the real money people, in such a way that's going to trickle down to our benefit. If someone has the answer to that, I would like to hear it. But I do think we should take care of ourselves and not punish the victims, by attacking each other or by doing things that are harmful to each other and to ourselves. And so I think to the extent, like my father told me a long time ago, the best way to help poor people is not be one. Well, I think if we can not be unhealthy and we can help other people to be healthy, and if we can, those of us who have somehow extricated ourselves from the grasp of poverty, if we can be role models and mentors to folks, I mean, those little things help. And if we can, again, begin to see our brothers and sisters as potential allies and not adversaries, and really identify the real problem as 90% who throw us the rest of us 10% to fight over. The 10% assets, why they control 90%. Until we get there, I don't know what the answer is from a societal perspective.
I have a question, Dr. Maxey, and you're muted just because you're on the phone, so you got to unmute yourself. This is a question for all three doctors, based upon what the young woman said earlier, and being a mother, a parent, and this being the last day of Mental Health Awareness Month. Are there any resources within the African American community that we as a community can turn to? I know there is the Association of Black Social Workers, I think it is. And then there's the Association of Black Psychologists. So can anyone here on the call speak to the associations that we do have within the Black community that we could reach out to? And I'm pretty sure that most probably would be willing to do a webinar or to have a community town hall. I think part of the challenge for laymen is that we see a lot of organizations that are set up to help us, not really helping us, we'll say, from an organizational standpoint, but also from an outsider looking in. I know you guys are practitioners and you have many, many years of experience in these fields. I'm just feeling like the Black community doesn't necessarily see these organizations on the ground like we should, or maybe we need to interact with them, let them know we want them to be on the ground with us.
Mr. Pratt, can you hear me?
Yes, sir.
Let me take the first crack and I'll let the speakers respond to that. We do have another number of those organizations. The focus of most of those is on the professional development of its members. Most of them are not primarily, if I'm not mistaken, directed outwards towards the community. And I agree with you, we need to do that. Amongst this group, we have established the Black Health Trust, which hopes to address this information gap and this planning gap in the form of looking at some of these issues and recruiting many of the leadership people from these organizations to work with us and us to work with them. The problem within our community is that so many of us are in silos and we don't cross communicate. And it is our goal to form a common bond that we can say the same things and get the information out and respond to our community. Tori Bailey is on the line. She had some comments about the police commissions and things that are going on. Ms. Bailey, would you comment? Can you make sure she's unmuted?
Okay,
There
I'm
she
unmuted.
is.
Okay, I was gonna say that we all have to get involved individually. We have police oversight commission here in Los Angeles, and we also have a few groups of people that actually consistently go to those meetings every week. There have been some challenges because a couple of them have been arrested for minute occurrences that have happened in those meetings. And that's kind of quieted down now. But we as a community need to be there in more presence. Like that meeting needs to be set aside and carved out in your calendars to participate as a part of the community. But I also belong to the Community Police Advisory Board. So each of your communities should have one of those where you interact with all the stations that are remotely surrounding your areas. So most of them know me by name. The other day I was driving down the street and I had on my mask, a hat, some glasses, so you name it. And I stopped one of the policemen and said, "What are you doing?" Because I could tell he was on some kind of mission. He said, "Tori, is that you?" I said, "It is." So, and he didn't know the car I was driving at the moment. So, but soon as I rolled up my window, he put that siren on and went on to whatever he was doing. But see, you got to let them know you know who they are as well as they think they know who you are. Otherwise, we will never get anywhere if we don't exercise our community relations with all these police in the community. The other thing I did was when Martin Luther King had their parade here, they sent in police from every other community but ours. So I taught everyone I saw, I said, "Where are you from? Where are you from? Where are you from?" And I asked each one of them. All of them were not from here. When an emergency occurred in the particular parade, when somebody fell out, they all just stood there and didn't do anything. So I had to yell at everyone and say, "Look, you need to do this, you need to do this, you call the ambulance." You know, so it was like, oh my God, it was somebody just fainted and nobody paid attention. So we got to be the ones to voice what's going on in our communities. And we got to be the ones who hold them accountable.
I agree with you. Let me put forth a statement, and I'm going to ask the speakers to comment one more time before we have the open mics. But it occurred to me that we have all of these muscular, big, smart young men who call themselves Bloods and Crips and other names. Right. And why don't we have a drive within our community to have thousands of these young men that don't have a totally bad arrest record join the police forces? Why do we leave policing to these deranged rednecks in many cases? Instead of protesting against the police, why aren't we the police, especially in our community? And I do recall that some years ago, my own son wanted to be a policeman because some of his friends were, and I told him I would disown him if he did. I was wrong. I think that some of our young men should be police. They should be postal inspectors. They should be CIA agents. They should be all these people that many of us call enemies. Why don't we take that over? But it impressed me that my friend Dr. Cooper emphasized to me that we should not just make an emotional response, but we should make a stealthy, intelligent, strategic response and not always just react to the bad situation, but take charge of it. I'd like Dr. Cooper to comment on that, Dr. Bailey and Dr. Simmons, and then we'll open the mics. Dr.
Well,
Cooper.
Dr. Maxey, since you gave me credit for saying that, I have a hard time challenging it. But no, I do agree generally that we tend to be reactive. We tend to emote, and what emotions do is tell you to do the first thing that comes to mind rather than the best option available, or even to develop a better option. So clearly, I think to the extent that we can be trained from an early age to not just react, but to be able to look at, why am I thinking of this situation this way? What other ways can I look at it? Which response can I give forth that would be consistent with the person I want to be, with the person I want to be? I think if we can begin to develop that as an early age, we can apply it when we need to. You know, I don't know what to say about. I agree that if there were more policemen there, but as you said, a lot of these guys get neutralized early with records. You know, and so by the time they can make a choice to go into the police department, even if they wanted to, they would not be eligible. And I think there's been such discord and animosity between the Black community, especially young Black men and boys, and the police, that it's not something that they feel any affinity for, or don't want to really be a part of it. They've been abused by them so badly. There's such a negative vibe between the two. I just think it's something that's not high on their priority list, even if they're eligible. And I think that the more talented ones who escaped, you know, all the real difficulties, move on to what they consider to be better options.
Dr. Bailey.
Absolutely. There's several points. First, I was going to go back to the earlier point, this idea of what are the issues and considerations regarding what individuals can actually do. And there's really a lot that we can do. I think there's a question really about organizations, and it may have come from, I think, Mr. Martin Pratt. As a Black psychiatrist, I, like many Black professionals, touch many organizations. It was mentioned by Maxey and the National Medical Association as a psychiatric section. I actually happen to be on the board of trustees of the American Psychiatric Association, 39,000 practicing psychiatrists. There's a Black organization of Black social workers, organization of Black psychologists. I've often thought during my 30-year career, one of our struggles has been that we're not speaking from one active voice. Some sort of a collaboration, I guess what we call a consortium, would have always been much better. Going back to when I first started in the early 90s, there was a disagreement between Black psychiatrists and Black social workers on transracial adoption. That may have seemed inconsequential to me then, but seems much more pragmatically important to me now, that a person like Mr. Pratt would say, I think very articulately, the community needs to hear from organizations, what should we do? What are the relevant points? And we may sound like disparate small voices. We need to be one strong, active, uniformed, united voice going forward. I hope that that's what is likely to happen here. This unfortunate episode may lead towards some improvement in some ways, a silver lining. I showed you literally today, I'm writing a piece for the APA and the NMA to hopefully get a joint statement on something as mutually involved and interested in as police brutality. It's never existed before. NMA has a statement, APA, AMA, what have you. Now, huge joint statements when there are fiscal issues involved. And Randall Maxey spoke very articulately when he said, often these organizations that should be both advocacy and trade organizations are mainly trade, benefiting the members on reimbursement and getting your licensure and how much you can be paid. But very often we are the most important people, especially in psychiatry, to speak for the very quiet and unheard voices of our patients who represent our societies. Very often, I think that are not only unheard, but very often ignored. To this new point, I think Dr. Maxey makes another very good point, this idea that we probably all, because of our reluctance with the police and law enforcement, have either said directly, as Dr. Maxey said, he told his son, or indirectly communicate the same message, you know, don't join them, we're against them. And it probably has hurt us. We clearly need community policing, so people should actually be from the community, live in the community, understand the community, be more likely to help somebody rather than hurt them. We all know that example that we saw last Tuesday in Minnesota. No one who thought that there was anything similar between them and a person on the ground who you had your knee on their neck would allow that to continue. And for three other policemen to be right next to him meant that there's a culture in that police department, and I'd hazard to guess it may exist in many police departments, that many policemen see themselves totally disparate from the people they are policing. And so four people could stand and watch somebody strangle somebody else without trying to intervene. I think there's other point that Dr. Cooper makes is also timely, though. You know, it's a struggle because all too often we put these barriers in place that limit young African American males from really expanding and growing in their own professionalism. Whether you want to go into, government work, police or fire, otherwise, rules such as if you've had a positive urine drug screen, you can't move forward. Well, I'm a forensic psychiatrist by training, and I'm here to share with you that I've seen those rules changed all too often in other settings. Most would be surprised to know that in Texas, for example, you can be a law enforcement corrections officer in a prison in Texas with a felony on your record, as long as it happened more than 5 years ago. And that happened because at some point, the people that they wanted to hire for correction officers, many of them have felony records. So they changed the rule. So I'm not at all a believer that these issues that once in place can never allow large numbers of African males to go into the police department. In fact, I love that. I think it's a salient idea. One I've actually really heard before, Dr. Maxine, was why I do these Zoom calls. You learn something new every time. That'd be a great, very pragmatic, very doable recommendation from African American groups going forward to make a way for young African American males to get involved in law enforcement. I think it could be the kind of thing that could change the dynamic remarkably. My final comment, though, is I think that this other point that I think was made, that all too often law enforcement and those who should be evaluating them, the DA's office, are too buddy-buddy. So you don't get charges filed against police in most of these cases. We would have charges filed in this case in Minnesota, but for video, and video from both directions at the same time, showing how bad it was and how long it lasted. Listen to what people say on television. They all talk about the video and how it's overwhelming evidence. It shouldn't be overwhelming evidence needed to convict policemen when they do bad behavior. We've had 100 years of this type of bad behavior, and report after report after report by young African American males of how bad they've been treated and mistreated and abused, and it's often been ignored. We all know about the so-called code of blue, how law enforcement very often will essentially lie and always say, I felt up under some risk. And we've got video now, the one in South Carolina a few months ago, where a policeman shoots a guy named Scott running away from him 8 times, then runs up next to him and throws a gun down behind him. We only got that one caught because somebody a long distance away behind a chain fence was videoing it. So there's a lot of information that we actually have, and video has actually made this piece a lot better in those circumstances, but it shouldn't require that for fairness and equity by the way police treat African Americans. It has to stop. And a few ideas that have been discussed, I think, on the call today have been helpful, and we should promote them going forward.
Dr. Maxey, you might be muted. Let's see. Yeah. Simon, can you unmute Dr. Maxey's iPad?
Okay.
Dr. Maxey, press it again, sorry. We had you and then I just lost you. There you go.
Okay. I would like the psychologist and the 2 psychiatrists on the phone to consider while I go to another person, should we design a psychological profiling test of current and future police? Because I think there may be a mild selection of who gets to be a policeman. I think that's a problem. While you consider that, I'd like to call on my colleague, another past president of the National Medical Association, who sent out an article this morning called The Anatomy of a Murder. Dr. Richard Williams, would you comment on the issue of that murder that we're talking about? Dr. Richard Williams.
Can you hear me now?
Yes, we can.
Okay, good morning, everybody, or good afternoon.
Good morning.
And especially to my friend Brenda. How are you? I hope that many of you received that letter to the editor of the New York Times that I penned and sent out this morning. If you haven't gotten it, I would encourage you to try to get it, and for Dr. Maxey to send it to all the people who are on this call or were invited on this call. I'm not going to go into the details of that. The thing speaks for itself. And it is, of course, about the George Floyd tragedy. And so to speak, a call to words, not call to arms, but call to action through words and deeds to address this egregious tragedy. I have a couple of things that I'll just briefly mention about what I've just heard so far. One thing is that I think Randall, your idea of having, so to speak, a community cadre of young men to impact upon these dangerous situations that are emerging in Black and Brown communities is a good one. One thing, though, that I want everybody to keep in mind is that it's a jungle and it's a war out there. When you talk about gangs in South LA, you're talking about murderous connections. And I don't think any of us would want to have our sons march into a situation like that without having considerable protection because they will get killed. As soon as those groups find out that somebody has been sent to look into them or the situation regarding gangs and crimes and so forth, or whatever it is in South LA, they're going to be targeted. So just keep that in mind, whatever is done, and I think something should be done in that regard. It needs to be done very carefully. The second thing that I want to mention is that the National Medical Association, as you and Dr. Ron Bailey, my good friend, know, address this problem of violence and the police use of force, excess force, when I was president of the NMA back in 2016 and 2017. And we wrote not only a white paper on that subject, but also an article which was published in the JNMA. It addressed some of the issues, Dr. Maxey, that you brought up, which have to do with the psychological training and actually psychological analysis of people who are candidates for police jobs. Dr. Roger Mitchell, who is the chief medical examiner of the District of Columbia, was one of the co-editors of that fantastic piece. And I would encourage everybody to take a look at that because it laid out a framework for how to approach this problem of police brutality and to look at it as a public health menace. I will stop there and see if there are any comments that will be made on my comments. Thank you.
Okay, thank you. Let me go back one more time to the speakers and then we'll open those mics. Dr. Cooper, Dr. Bailey, and Dr. Simmons, would you care to comment if your organizations or you could be involved in creating, I remember, I think the Black psychiatrists or the American psychiatrists created something years ago called the Stay 9 test. Is there any way we create something that is a qualification test to even apply to the police department for all people, not just Blacks, but whites, and so we can root out some of the bad apples? Is that something that could possibly be entertained?
This is Ron. Absolutely. Early in my career, my very first job in '95 was at LSU School of Medicine in New Orleans, and one of my responsibilities was to conduct the psychiatric initial evaluations for the New Orleans Police Department. And I've discussed this for 25 years now, but I always tell people I walked with four thoughts. One, first and foremost, you do make a test that is relevant for you. You decide at what level the barriers will be or the cutoffs. If you don't want people who can't run a mile in 10 minutes, you make it, 11 minutes or what have you. And if you change that cutoff, some folks won't actually make it. And that's the analogy for running a mile. The analogy actually is the same for the psychological test. Secondly, generally in those type of assessments, Dr. Maxey, all of the tests are done. So it's not a function of passing or failing them is generally a general consortium of ideas if you look at a variety of psychological tests. But what you can do very often, I think my third point, is you can see patterns. And I was always very surprised that we had quite a few people who would try out for the New Orleans Police Department, come to LSU School of Medicine for an evaluation, and they not only shouldn't be in the police department, they probably were at risk, I thought, of regular everyday life. So your earlier comments, I think, is actually accurate. We probably should be very mindful of the types of individuals going into police departments all over the country. I think that we're probably not getting a normative, component of the American population. We're the people who I think are already predisposed to some of the kind of aggressive violence that we're typically seeing, especially I think in communities that are different than them. That's why some places like in Memphis, they make a rule you have to live within the county, because so many people live on the Mississippi side of the line, but with police and fire in the city of Memphis, we're antagonistic toward that patient population. And my last important, I think my most important point, I think we also should appreciate that there probably is an ongoing new generation activity that's very harmful for these type of law enforcement type settings when you're involved in police and fire, whether it's certain kind of media, whether you want to call it conservative media. There's a drumbeat, a rampant, incessant beat of negative commentary against certain communities, which I think fuels the fire of hatred and discriminatory bias towards certain groups. We do see it. You may be likely to see it in this case later. We saw it in the case when Michael Brown was killed in Ferguson, Missouri. When we found out about that policeman who had done the shooting later, what the individuals are reading and listening to is, I think, worsening their fear of these groups. And you go into your daily work, I think, with this bent antagonistic towards some person you're likely to hurt. That's why you'll see this kind of thing against a 40-year-old black male. You never see this against a 40-year-old white woman, that a police will do something like that in any jurisdiction, in any place. So clearly there are some systemic problems that exist, I think, across police departments in our country. And we've got to have, I think, some overall global systemic type approaches. This may be one, but trying to get more individuals involved in police and fire rather than being away from it, I think is a very good start.
I think your comments are very relevant. I always heard that the statement that if I hurt you, should you be afraid of me? Probably yes. In this context, Ms. Simmons and then Dr. Cooper, to comment on testing of these police, and I understand that the employer who owned the nightclub that both those gentlemen worked in, well, one gentleman and one killer worked in, stated that the white policeman had a fear of black men. Ms. Simmons.
Hi, so just real quickly, just to clarify, I'm not a doctor, just need to say that, I'm a therapist, but I think the idea of testing is a part of it. I think we need to be careful about who developed this test, who is interpreting the test. When you're talking about testing large groups of people and you have a test that maybe wasn't vetted on many groups, and the research needs to be solid. And then I think testing is good, but when you have, again, like you're talking about officers who are on the force over years and years and years, and to ensure that attention is still being paid to their mental well-being in terms of how it relates to how they carry out their jobs is another part of it that would need to accompany a test to even see that they get on in the first place. So.
Thank you. Dr. Cooper? Are you unmuted, Dr. Cooper?
Am I on? Can you hear me?
We can, yes.
Can you hear me now?
Yes.
Okay. Testing has been done with police departments in Cincinnati since the 70s, but I kind of remain unimpressed by the predictive ability of some of these tests. Many people who come in with certain patterns, as they stay in, they become acculturated to the police culture, and you'll see their behaviors change over time. So I think as important as any kind of screen you attempt to apply on the front end needs to be complemented with monitoring and continued training and things of that nature, and needs to have consequences attached to undesirable behavior. And consequences that aren't applied by the police department, but by some disinterested third party that has the ability to evaluate whether or not they're following policy and procedures or represent a risk. So a couple of things. It's hard to identify them on the front end. Who's going to be violent, who's going to be inappropriate, and it's important to realize that they will change over time, and they'll tend to change in the direction of whatever the culture of that department is. And then you have falsification of records. So even in ongoing monitoring, what do you use for data? You know, because the data that you may be presented with bears little resemblance to what really happened. You know, I think Will Smith that said police brutality hasn't increased; it's just being filmed. You know, I'm sure that this level or more brutality occurred before, but we couldn't prove it because the data that was used to make that determination was their data. So, you know, I'm all in favor of testing, but I think monitoring is probably equally important. And consequences, I think, is even more important.
Okay, well, thank you. And I was specifically referring to tests that your organizations, our organizations develop for all police departments. And with regard to Dr. Williams, I wasn't speaking about policing the Bloods and the Crips. I was talking about people in that genre become. I'll ask one question, and I noticed there's some comments and questions in the chat box, and people have raised their hand. I'm going to ask Simon Cooper and Pratt to help me get those questions answered. But I noticed there's one of the few Black female general officers of the U.S. Army. And we know that recently there's been noises from the White House that they're going to activate, for the sake of riot control, active duty U.S. Army. And many of you know that the active armed forces are not allowed to work within the continental United States. But we also know that they passed in 1948 an amendment to the so-called McCarran Act, which allowed the internment or imprisonment of Japanese Americans. This was called the King Arthur Act. And it's a matter of the congressional record, which was just repealed in 1964. And that said that on order of the President of the United States, after a major racial insurrection, that all Black people, they probably called them Negroes in that day, would be imprisoned, incarcerated, or terminated within 30 minutes. But in that light, in the U.S. Army, as you know it, General Nero, one, is it possible to bring in active duty U.S. forces? And two, is there racism among the key ranks of that organization? General Nero, can you unmute your phone?
Can you hear? Hi.
Now we can hear you. Introduce them. Tell them your
Hi,
rank.
I'm Carrie,
In the
Carrie
Army.
Nero, retired Brigadier General, Army Reserve. The questions that you posed.
General Nero, one second, General Nero. Can you move your screen a little bit down so we can see most of your face? Right now, we're just seeing the top of your head. There you go. Thank you, General. Thank you for your service too.
You're welcome. Dr. Maxey is very pointed with his questions, and he knows that some of the information that we can't speak on directly. But let me say this briefly. In the culture that we have with the police department, and I'll speak on this end because I had a brother, my husband's brother was with the police department for 40 years, the only one in the state of Florida that served for 40 years. In fact, he was an advocate for policing in our community. They not only did they do I would say they did, it was a 13 of them, 13, they call them the Buffalo 13. They filed a lawsuit against Pinellas County state of Florida Police Department, they were denied. So they took the lawsuit to the federal government. After searching and reviewing that, it was looked on as there was clearly bias in the police department. Now, they didn't use terms like racism and how we are serving in the Black community, but they were not able to arrest outside of a certain parameter, which was primarily the Black community. They were not able to dress in the police department. They were not able to drive the police cruisers. So from this lawsuit and just getting in and looking and listening to him for the community that he served for 40 years, he was a peacemaker, and he often was on the scene to help brothers and sisters in our community. But when he joined the force, it was a culture, and the culture still exists today. It's not easy to break those ranks to get into the police department, even to make from sergeant to lieutenant in the ranks. So what we're talking about today is, it is systemic. It is something we need to address, and it needs to be addressed across the parameters, across the world, because it exists today. And I'm a family member of one that experienced that. And I know on many, many occasions, Horace was called to defend the community and to defend Black brothers and sisters. He put his life on the line for us. And it is still, and it just, when I see the clips that we've been looking at for the last couple of days, when I look at the turmoil that we're having in the different cities and the voices that are speaking out, it's real. And it's like in any other high, if you want to say, being very careful with words, because they take everything a general say and then they're taking it turned around. So I have to be very careful what I say. But in certain classes, and my phone is going off. My phone went out.
Okay.
We can hear you though.
Oh, you can hear me?
Yes, ma'am.
It's just breaking and going through the cultures that we have to go through. Whether you're in medical school, if you're in universities, the stigma is there, even when your grades are the top of the class, getting in certain positions. It's, do you know someone that can help me? And we're the voices that speak out. So today we should be the voices speaking out in our community, because it's there, it's clear.
I'm going to ask the same question of retired Admiral, Navy Admiral James Johnson. When I became president of the National Medical Association, we honored at our convention all of the general officers, the Navy admirals, public health admirals of the United States Armed Services who were MDs and who were African American. And of the 32 at the time, we had a response of almost 26 that showed up, and Admiral Johnson helped make that happen. Admiral Johnson, would you comment on the same question I asked General Nero?
I'll first of all say, while I'm a staunch Navy supporter, I will give my props to the Army that in terms of African Americans reaching high ranks within the services, the Army was first. And the numbers of Army generals much greater than the number of Navy admirals. The Army has held a gathering going back to the Colin Powell days in the late 80s. My recollection is the first week of October, the Army has a system-wide meeting of its general officers. It's been going on for decades. At Colin Powell and others at the time, started meeting the Sunday before the Army General Officer meeting and what they call the fall gathering. And a large part of that was for them to look at the status of things in the Army, particularly to look at the younger officers who might have potential to grow to the senior Army ranks and reach out and make sure that those young African American officers were mentored. In other words, they created a good old boys network. There is absolutely nothing wrong with the good old boys network. The good old boys network applied across the spectrum is what we call a mentoring system. And it's very effective and it works. The problem with it is if you are not a Caucasian male and that's the only people who get access to it, that's the problem with the network, of the good old boys network. But if you apply it universally, it has great applicability. Now, when I became an admiral in the late 90s, it was the first time that the Army opened up its fall gathering to all the services, the Navy, the Marine Corps, the National Oceanographic and Atmospheric Agency. And it was held at one of the Air Force bases. And there were maybe 10 tables of 10 people at a table. Nobody's in uniform. Everybody's wearing a business suit with their spouse or whatever. And at every table, the Army had enough 3 or 4-star general officers, retired and active, to have at least one of them as the host at every single table. This was about 1999. At that time, the Navy had one or two 3-star admirals, most of whom had just been selected. And I selected as the first active duty African American flag officer in the history of the Navy Medical Department. Keep in mind that the Army and the Air Force had general officers going back to the 40s, the 50s. And I was impressed. And the reason why I'm saying this is, in order to make real change, something has to happen a long time before. The increased number of African Americans in the services had to start. I was mentored by not a single African American flag officer because there weren't any. Going back to when I was a young lieutenant, someone saw something in me and they gave me opportunities, which I didn't. But when I look at what's happened over the last, particularly 48 hours, and in my own community, I live in El Cajon, the town next to me, La Mesa, which is 2 miles away. The town center was essentially burned to the ground last night. The banks, police department, everything was attacked. What started out as a peaceful protest yesterday afternoon, as in many cities, by evening, large numbers of people not from La Mesa came in and did their thing. By 3 o'clock in the morning, the people of La Mesa who were affected by all this were out cleaning up the glass, boarding up things, and whatnot. And
Admiral Johnson, I'm liking everything you're saying, but one question in particular I wanted you to address, and then I was going to ask Admiral Brewer to speak briefly. But
you wanted to ask about how things, I put that together. And the one last thing I want to say about race relations in the military per se, is there racism in the military? The question is absolutely there is.
Can we bring U.S. troops into the continental United States that are on active duty?
I'm not a constitutional lawyer. I would leave it up to them to say the constitutional question. With respect to the current commander in chief, he doesn't seem to be particularly moved by paying attention to any kind of constraint like that anyway. So I would not want to say that there's no capability of the current commander in chief making an order like that. Whether or not it's legal or I'm not sure. My gut tells me it isn't, but I don't know that the current commander in chief pays much attention to that a lot of the time.
Thank you so much. And I think your comments on mentoring are so important. Is Admiral David Brewer on the phone? Is Admiral Brewer on? Okay.
Can I say one last thing, Randall, real quickly?
Yes.
Some of you are old enough to remember the 1972 when there were a number of racial problems on Navy ships. The USS Kitty Hawk, the aircraft carrier, deployed. One of the other ships that had a big racial upheaval while deployed was a ship I was on, the USS New Orleans, back in 1972, and I'd been on active duty for about 3 months. To give you the difference, at that time, the New Orleans was a deep draft amphib carrier that carried about 2,000 Marines in the combat, and we were deployed just off of Vietnam at the time. The total battle group had probably 3,000 or 4,000 sailors in it. As a fresh caught lieutenant, I was the senior African American officer in the entire task force. And after a night of people running up and down ships, fighting each other, which is not a good look when you are 5 miles from a war zone and sitting on top of an ocean full of sharks and 5,000, 8,000 miles from home. And I was tasked with being the person to help bring the African American side under control, which I was able to do. And I was able to do it because I said to the group assembled, if you look 3 miles to the west, there's a war going on. If you jump off this ship, you will be eaten up by sharks. You are roughly 6,000 to 7,000 miles from home. I have a wife and 2 kids. This ship is the only way I get home. Anybody who does anything to keep this ship from getting home is my enemy. Anybody who does anything to help this ship get home is my friend. I am a partially trained surgeon, extremely skilled in using knives and other implements for hurting people. You do not want me to be your enemy.
I like that.
And the next night we had no more racial issues, at least not riots.
Well, thank you, Admiral. Thank you. Is Admiral Brewer on? If not, let's go to the chat room. Simon and Pratt, can you help bring forth those who raise their hands or questions? And let's recognize them. Simon or Mr. Pratt?
No, there's no questions in the chat room right now.
And no one has a hand raised.
I'd like to raise my hand, Dr. Maxey.
Go ahead.
He just
Go
did,
ahead.
Dr. Williams.
Go ahead, Dr. Williams.
Okay, this is going back to a point that you made earlier in regards to getting some input from organizations and expertise from psychiatrists and psychologists and so forth regarding the question of arranging some criteria, so to speak, for admission of individuals onto a police force based on their psychological profiles. In any event, this is also something that was brought up in the white paper that was put out by the NMA back in 2017. And the reason I'm repeating that is because of the fact that in that white paper, we also noted an association that we were beginning to make with the National Organization of Black Law Enforcement Executives, or NOBLE. That's a group of nationwide group of Black, either former or current police chiefs, and other executives in law enforcement. And they had expressed an interest in working with medical organizations, Black medical organizations, in trying to do exactly what we were suggesting. As far as I know, that never followed through. And it's something that I think, and Ron Bailey is, I hope, still on the call, is still interested in trying to carry that out, because I think that's the key. If we can work with some Black law enforcement executives in regards to these things that we're trying to put through, I think we'll be well ahead of the game in doing that. And I'd like to hear any comments that anybody would like to make about that. But remember the name of NOBLE, the National Organization of Black Law Enforcement Executives. That's extremely important for us to keep in mind and to make a connection with.
This is Ron. I'll just squeeze in very briefly. Yes, you're exactly right, Dr. Williams. I think that that is a timely relationship, I think, for us to work with kind of going forward. About a month or so ago, when this process started, and we all started doing these Zoom calls, I was on a call led by one of our enemy contacts, Sheila Thorne in New York, and one of the leader for Noble X was on the call. And we discussed then what you're saying now, that although it wasn't quite at the same level of Dr. Maxey's comment, that we should have an active project trying to get more young African males involved in law enforcement specifically. And I like that idea. I've repeated it before, but discussing these kinds of strategies to enhance community policing, one, decrease the active antagonism very often between ethnic minority and Black communities and police force, two, third, enhancing this issue that if police engage in bad behavior, that there be some consequences, including and up to criminal consequences and conviction. And very often you don't tend to see that. This would be, I think, a very bona fide, very strategically effective way for us to kind of address our needs, because they're an ongoing project. We all want for this not to be something that is a hit or miss. We're all very involved in it for 30 days and it goes away when the next news cycle comes on. So finding some strategies we can actually employ to link to organizations going forward, I think is going to be key. That's a good idea.
Well, thank you so much. I want to remind the group that as a result of these calls, knowing that there is a lack of confidence in a lot of the data coming out of the various official sources and the non-official sources, that we wanted to create something that was credible, where you got information from healthcare professionals and physicians that you could count on as being vetted and reasonable. And from that, we got the idea of creating a nonprofit organization, and we've named that the Black Health Trust. In a comical way, somebody said, well, we're going to be the Black Justice League. And I said, got to find out what kind of color capes we wear. But nonetheless, we are forming that nonprofit. And that nonprofit will recruit healthcare professionals, many of whom are on the line now, to vet information and put it out, whether it be digitally, online, or print, so that every few weeks and every month there will be comments that we make regarding the protections that you should be using for yourself. And I want to reiterate that it is still appropriate to wear masks when you're around people in public, and that is both for their protection and your protection. It is still extremely relevant to maintain the sanitization of your hands with at least 60% alcohol. We have recommended that you wash your hands with soap and water for at least 20 seconds. Somebody said if you say happy birthday twice, that is that. We recommended that people eat a more plant-based diet and that it be high in antioxidants and micronutrients. And I substituted micronutrients to mean prenatal vitamins. I guarantee you I'm not pregnant, but they do have all the micronutrients. It is important to maintain your health and your immunity as much as you can. We do know that if you're obese, if you have diabetes, if you have hypertension, and if you're under a lot of stress and anxiety, your immune system is not as good, and you may become more liable to succumb, not necessarily die, but be affected by the COVID and by life or death in general.
Dr.
And that
Maxey,
is,
can we
yes,
get you to turn your camera on the iPad? Sorry
yes,
to interrupt you.
okay. So I want to keep that in sight, that there are things we must do. I do believe that as the company opens up, as the country opens up, you should be very careful to analyze what your job and what the risk at that job entail, and speak up for mitigation efforts that the job has to do to protect you and your family. I know when our children go back to daycare and go to school, you need to be assured that they're appropriately protected, that they're exercising the appropriate precautions of isolation. And don't think that this thing is done yet. There's a lot more to this pandemic that's there. We also have made a relationship with a company called Second Opinion Experts, and we're in the process of contracting with them to create a division that will be staffed by Black health professionals who will be available to give you consultations, whether it be a second opinion or a first opinion. And we're going to have available a testing thing, a questionnaire that will evaluate your risk factors, not only for COVID, but for cardiovascular disease, psychiatric disease, obesity, et cetera. And that will be available probably within the next week. We're moving fast on that. Also, to supplement how we fund this Black Health Trust, which is a nonprofit, we have a strategy of memberships. And hopefully that will include the services of the second opinion, the Black second opinion, or first opinion organization. And we're asking members of the National Medical Association and other groups that we know to take a part in that. And I've questioned and asked each of the individuals that spoke in previous weeks and speaking today to be some of the experts that would be available to give you credible information on that. Having said that, I'd like to know if there are any other comments or questions. I'd like to make sure that people feel that they've been able to ask the questions. They can be on the topics discussed, or they can be totally different. Please speak, but take 30 seconds or so to ask your question, not 3 minutes.
And Dr. Maxey, can we get you to turn your camera on the iPad? Thank you.
Well, I don't know.
Let me see. We got
Martin, you can try and prompt him.
It's
from the
been
host
this.
account.
Yeah, I have Roz. I have no idea. He was able to turn it on before without prompting, so I'm not sure. There we go, Dr.
Yeah.
Maxey. Good. Yeah.
Okay. All right. The floor is open. Don't everybody jump in at once. Dr. Bilal.
Oh.
Dr. Bilal, I'm calling on you.
Dr. Bilal, you're muted.
I am here. Yeah, as far as the Black Trust, I would like to know when is the next meeting. I missed that first call when you were organizing it, and then I didn't hear anything back. I've been really busy, like we all are. But I would like to definitely be a part of that Black Trust from a herbalist standpoint, and direction and solutions as well. So I would like to know when that next meeting is.
I will notify you by email after this call. We haven't set the meeting yet, but I will definitely make sure you get a notice of that. Dr. Blau has been creating health products. He brought some to my office and they were strong, and I'm working with him. I would like to make that a part of my practice. Now, Maxie, any comments?
Dr. Maxey, this is Tori.
Yes, Tori.
I was overwhelmed with joy when you guys brought up the model of behaviorism for the police department. I was thinking, we know someone that's local that he actually created a model that would be absolutely amazing to run it, and maybe we can get a couple of the stations to be a pilot, to create a pilot program to make that happen. But I think the three that spoke today would be ideal to sit down with this particular gentleman who created the model. And we all know him. You just don't know he's created a model, perhaps. But it would be awesome to sit down and vet that model and see if we could actually deploy it. Because, and I want to ask Dr. Williams, what was the title of that white paper that was in the NMA or in the journal in 2017?
Dr. Williams?
Yes, Tori, I don't have the title right before me, but
Okay.
it's possible just to go to the NMA website and go back through the journals in the search bar and just put in white paper on violence and the police use of force.
Oh, okay. Yeah, I can find anything. Okay, I'll look for it.
Yeah, it would have been in 2017.
All
okay,
right.
and I'll send you the title. Okay, thanks.
Okay, I'm calling on names that I see for comments or questions. I see Lady Bishop Pate.
Amen, Dr. Maxey. We're here, Bishop Pate and I, and we're just so grateful for everyone on the line. And for those who shared their expertise, we certainly have learned. So thank you. Here's Bishop Pate.
Yes, this has been a real blessing today. And, we are in a battle for the survival of our people. And we think that I'm seeing the principles of safety in operation. The scripture says there's safety in the multitude of counsel. And I've been really blessed today.
Well, thank you very much. I want to make a comment before I recognize a couple of other people. I have a concern about misinformation and misdirection. And we know we have a problem with public safety, both in terms of actual pathologic disease and with racism. And with these riots going on, one side is saying that it's leftists during the rioting and looting, and the other side saying it's right-sided extremists doing it. But I really don't care who it is. We know that it is misdirection. We want to make sure that it doesn't take away from our purpose of getting rid of racism, but we shouldn't be lured into emotional reactions. When I was in medical school and we were so-called revolutionaries, we found that the people egging us to do something dumb, nihilistic, and stupid were actually undercover cops, undercover CIA, and whatnot, making us do something that would allow us to get incarcerated or shot. So it's very key that we not make just emotional reactions, but rather well-considered intelligent reactions and not be diverted by either side of extremism. And I
Dr.
certainly
Maxey,
yes.
can you back up a little bit from the, yeah, there you go.
Don't worry about that now. What I'm concerned about is that we not be misdirected we not lose our focus, we not lose our purpose, and we not burn up our own assets and resources. In some places, they burned up the only drugstores that we had to go to, the only grocery stores that we had to go to. So I don't care who an agitator is, if they're doing something to hurt us, I don't care if they're black, white, or green, they're enemies. And I'm concerned that we stay on purpose from what we do. And I'm determined as much as possible to interact with colleagues and friends and supporters that we walk the road that is best for African Americans and other people of color. Ms. Megan Williams, do you have a comment from Florida?
Hey, Dr. Maxey, can you guys hear me?
Yes.
Okay. Yeah, I actually had a lot of comments. I guess I'm going to speak from the heart because I'm not as conservative as most, I think, when it comes to these matters. But I'm going to go ahead and shoot. The one question I had that came to mind earlier today, I had a friend ask me that I know how many police officers that were veterans. And out of those veterans, were we aware of their mental health status? Like, were they suffering from, PTSD or what have you? And I thought that was an interesting question. The next thing I had was with what I call them soldiers out now that are rioting and protesting, because they're the young generation, and it looks as though they don't have any guidance, or if they're soldiers, they don't have any generals, or anyone telling them like what to do. It's kind of like they're just all over the place. And I can't say that I don't agree with it, because I do. I don't think that it's ever been equality for us in the United States or in around the world. So I like to say that I listened to some of our influencers, and a lot of them are being conservative and making statements, about, what we're doing, but what we've been doing in the past has not been working. And I think about, as you say, hey, Rome hasn't been built in a day, or Rome wasn't built in a day, right? And right now I look at, let's just say Rome is being burnt down. And with that being said, thinking of, how do we rebuild Rome so that it's built by, or for people of color, so that now as we're rebuilding something that has been built on our backs or on our necks, where we haven't been able to breathe for so long, how do we rebuild that so that now that everything that's made, is for us, it's for people of color, the products, the testing, the resources, they are actually made for us. And we do benefit from those things. And the last thing I like to say, I'll cut it short because I could probably go on, but talked about the mental health status and being anxious. I've suffered with anxiety probably for the last 7 or 8 years. And if I could share anything with Michelle or anyone else, that this is probably the first time in my life where I just have such a peace about me. And I have so much faith in knowing that what is happening now has to happen, and it needs to happen. And we talk about revelations and what is being revealed. It has to be revealed. And I just have faith in knowing that, hey, yeah, it's going to be rough. It's going to be turmoil. It's going to be things that are happening. We can do what we can to stay out of harm's way. But it has to happen. And in the end of this, we're coming to an end. It's a changing of the guards. And in the end of this, that our people actually fly high, and we win. And I just have a peace in knowing that. And that's coming from a person who suffers with anxiety. And I'll just stop there, Dr. Maxey.
Thank you, Megan. Brenda Lee Ager is on, and she sent me a trailer of a new documentary that is going to be coming out in a few months. And she was involved with Operation Breadbasket and back in the day, and she's done a lot. I'd like her to comment. And Megan, I'm gonna come back to answer some of your questions. Ms. Brenda Lee Ager.
She's not in her seat right now.
Okay, would anybody else like to comment?
I'd like to make a comment
Go ahead.
before she comes back. Two quick things. One is I want everybody to remember a very important historical occurrence. Many of you may not be aware of this, but today is the 100th anniversary of what? Greenwood.
It's I'm sorry, it's the 99th. 100 is next year.
Okay, thank you. Okay, of Greenwood. This is still long enough, too long. Greenwood was what we call Black Wall Street in Tulsa, Oklahoma. It was burned down by white people. Over 300 Black residents, very wealthy Black residents, were killed. It was a massacre. It has been buried historically over time and is only now coming back into recognition. I want you all to keep in mind that it can happen here, that Greenwood was a tragedy which can be repeated. It ain't over until it's over. And the last thing I want to mention is the importance of what is happening locally from the standpoint of the acuity and infectiousness of COVID-19 in Los Angeles County. Some figures just came out last week, which indicate for the first time that there is a strong majority of Black deaths occurring in areas predominantly in Black patients, Black individuals. And one of the things that I remember from medical school that they taught us that everybody in your class will not succeed to promotion to graduation. So that if you look at three people who are sitting in the audience in the amphitheater listening to a lecture, the professor often would say, "Look to the left of you and look to the right of you. By the time graduation day rolls around, one of you will be gone. 30% of the class may be missing." And that is the case with Black people and the COVID-19 virus. We are under assault. We've got to recognize that we've got to do a better job among ourselves in protecting ourselves from this scourge. And at a later date, I'm going to give you an update, Dr. Maxey, on some of the clinical aspects that I always say are in flux in regards to this disease. Thanks very much.
Thank you. Mr. Bill Dickerson, you work with Reverend Jesse Jackson, and I'd like you to comment on some of the points that have been raised. Mr. Bill Dickerson, are you on?
Mr. Dickerson, you're on mute. You can, there you go.
Okay, thanks a lot. I don't have a lot to say in terms of how we should approach this, but I've learned a lot today, and I will definitely inform Reverend as we go forward, and see if I can get him on one of our meetings.
Well, thank you so much. I noticed Brenda Leager is back. I opened the mic for you to comment, and especially about what you experienced that is in your documentary coming up called Soul Sister.
Gotta unmute yourself, Brenda.
Yeah, I've got this new computer that my children bought me, so I'm trying to figure this out.
Hallelujah. Praise for the next the generation that supports his mama.
Well, you know, this whole thing now, it's heartbreaking for me in one sense, and then in the other sense, because we did this 50 years ago. We marched, we did all of that stuff you've seen that you'll see in the documentary. But I think this particular time, even though it looks chaotic, I think there's a lot of coming together of our youth. I think they're smarter. I think they're more, I don't know if they're more diligent, but I think this had to happen. And I wouldn't call it a riot. I've been calling it an uprising. An uprising is when people change and made the change happens through an uprising. So I'm still in the game. I'm 72 and ready to do all that's necessary to make this dream come true of Dr. King's and all the rest of us. So if we just continue to eat well, get your sleep, exercise, and go to that realm where you know that everything is possible, and we not get caught up in the this is just another way that it's not going to happen. Yes, it can happen when we hold our heads up and hold the dream up, and then put the feet to working. If we got to go, we got to go. Get out in those streets, go to door, whatever we have to do. But I know that this time, I just feel it in my heart, this time will bring about a change more than any other time. I'm feeling it. And Mr. Dickinson, say hello to Rev for me.
I'll definitely will do that. Thank you.
Thank you very much, Brendan. Again, I want to make some comments. People can react to them, and I don't want to have the call go too long. But I don't think very many people have accused me of being conservative. But I recall my years in medical school, in particular 1968, when Martin Luther King was assassinated. And I was working in what we call the dog lab. And Dr. Cooper may recall that even on Saturdays and sometimes Sundays, we were in there doing our research with those dogs. And we looked out the windows and the city was burning. And I decided that I had had enough. I wasn't going to take it anymore. And I was going to resign from medical school and join the so-called Black Revolution. And my professor, Dr. Walter Booker, said, well, Dr. Maxey, or Mr. Maxey at the time, I will never tell you not to follow your principles, but before you do, I have a suggestion. And as a result of his suggestion, I made 3 weeks off of medical school, and I toured the inland eastern waterways of the United States, and I found that there were weapon systems that were not unboxed yet. I went to the mountains of Pennsylvania and found that the prison camps that they used for the Japanese and the Germans in World War II, which you would expect after so many years, would be dilapidated, falling over. But the grass was cut, the fences were shiny, the buildings were new. And I surmised at the end of that trip that there was never going to be any armed revolution that was successful in the United States. And I went back to medical school. I could grow hair at that time. I cut my afro off and I said, I'm going to graduate. And I'm going to fight my battles smartly. If I got challenged to a fight by Mike Tyson in the ring, I wouldn't think about going in the ring to fight him. I'd poison his water first. In other words, I'm saying you've got to know what battles you can win. I do not believe that there is a physical, military, emotional win in the streets. I do believe that there's action in the streets, but it needs to be smart action. I do believe that there's political action that's smart. I do believe that things like being the police department, getting elected officials done and being smart, but I do not believe that 10% of the population, which is basically not armed, can defeat the largest, best equipped military in the history of mankind. That doesn't make sense to me. Now, the reason I brought up the military general officers and admirals that I did, they know what those forces are. And even now, years later after they're retired, they know what is dangerous for them to say and represent publicly. That doesn't mean that's how they feel. So I think that we need to be smart. We need to have stealth. We need to have organization. We need to have cooperation. That's what has been our downfall. And I'm very concerned that we don't get led into battle, physical battle, by people who don't care about us. And whether it be Antifa or the radical right, whoever they are, I think we need to be cognizant that there are disruptive forces of misinformation out there. And we need to have a way that we can work together, and sometimes it needs to be undercover. But just having your emotions satisfied by a day of throwing a rock is not going to get it. And therefore, we hope to work together with groups like the NMA, the APHA, and the other organizations, and some non-organizations, to work with everybody to do that. And I hope that the start is this group being communicative of credible information. We have another group called the Select Roundtable, where we have military experts, health experts, artificial intelligence experts working together to gather the information we need, because the first part of any war is knowing your enemy and what their resources are. And so we hope to gather those and use them to our advantage. I want to make sure that a few people get to speak out now, and then I'd like to end this call in the next 10 minutes. But I did want to say that, no, I'm not conservative, but I know when I'm up against Mike Tyson, and he better watch his water. Any comments? My mentor, Dr. Williams. Dr. Bilal.
Yeah, you brought up some very good points. One thing that we need to consider is we need to put together some type of economic base, like you said, recruiting young people into the police force. We need to have some money so that we can influence some of those young people and maybe take them through some of our training and our goals, so we could get something that they could understand. Because just to basically blanket say, yeah, okay, Blood and Crips, come on and join the police force, that's not going to happen. And there are some organizations who are working with people like that, and we should reach out to them. Another thing that I wanted to talk about, the Queen Megan mentioned about anxiety, and I've dealt with anxiety. I had anxiety attacks when I turned about 50. I was going through a lot of stress. It was a stressful time. And a lot of my clients have been experiencing anxiety. And there are some things very inexpensively that you could do to work on that. I'm gonna give you some of them. One thing is like chamomile tea. It's very effective when you want to relax in the evening. Also hops. Then there's valerian root. And there's another one that's really good called Floriditila. A lot of times you can even find those at the grocery store in those little packs that the Mexicans buy. I will post a list of things like that. And also, we got to take care of our health during this time period. We need to watch out the COVID-19 is a virus, but a lot of the people that die or perish die from pre-existing conditions. And it's the regular stuff: overweight, congestive heart failure, pneumonia, diabetes. So we need to eat, get away from meat, dairy, starch, and sugar. None of us are perfect.
I think you're 100% right. And I'm going to ask you to write that down so we can publish a lot of that so we can get it out to everybody here. I think
Absolutely.
In your knowledge, I'm going to ask you to commit that to writing and let's publish it to the group. Are there any other comments before we?
Absolutely.
Yeah, since you, hey, Randall, this is Dave Brewer. Since you invoked the military.
Oh, I was looking for you earlier.
Yeah, I just got on a little bit later. I think it's important to bring us into this conversation, having, since we understand how to think strategically, and because I was a child of the 60s. I was at Howard when you were there, and I eventually went down to Prairie View and graduated from there and was of course commissioned. But the thing about it is we have a very unique capability to come in and help people think strategically. And we're gonna have to think strategically in terms of how we move forward. I've been blessed to have been on the education side as well as the military side. So you're gonna hear this. I'm writing my book, and I'm gonna probably talk to some of this. I was stopped 3 times, racially profiled 3 times in the Navy, twice as an admiral, and I'll get deeper into that later. But the bottom line is that we have to attack this structurally. Until we stop, middle-class people don't go into Walmart and rip off, big screen TVs. They go after you in economically and politically. And so we have got to get our people to the point where we don't have these poor kids running around. I mean, you and I saw this, in 68, 65, we watched all this rioting. So we know what the outcome's going to be. And unfortunately, those communities that have been devastated are going to take years to come back. I just saw some radicals talking about, yeah, well, Target got insurance. I said, yeah, Target got insurance, but guess what? If they rebuild, the insurance going to go up and your price is going to go up. Okay, so you just had tremendous economic impact on your community. Don't be dumb, be strategic. Okay, so bring me in. I think Jim Johnson will be ready to talk about this. And let's talk strategically. I have a strategic plan that I think we need to consider.
Well, thank you. We will definitely, maybe on our next roundtable call, we can have that conversation. And Admiral Brewer was not only an admiral in the Navy in charge of all the Navy's logistics worldwide, but under his command were the famous ships, the Mercy and the Comfort. And later he became the superintendent of schools of the Los Angeles School District, one of the largest school districts in the country. So we definitely appreciate your input. But more satisfyingly, he's the son of a 100-year-old mother that he takes care of purely by natural medicine. Am I correct?
That is very true. Dr. Bilal and I talked, and when he mentioned chamomile, I said, that's the last cup of tea I have every night.
All right. In a humorous way, I'm going to remind you the chamomile is actually ragweed, but maybe that's good. Any other comments before we ask the bishop to take us out in prayer?
Dr. Maxey, if I may, this is Lamont Gibson. To your credit, it may be ragweed, but it sure is good. It works very, very well. And there are other things that work very, very well that were mentioned, in fact, on this call, but we don't have them prominently labeled. Some of them are combined in a product called Altaril that has valerian, melatonin, and L-tryptophan. It's sold as a sleep aid. We can use some education, Admiral Brewer. We can use some education specifically as it relates to strategy. And I have to call on our guests for today, Dr. Cooper and Dr. Bailey, because they said some excellent things that we really, that Dr. Bailey talks too fast. We can really use. And if we can come together with some form of algorithm that folks could understand and remember after they heard it, because sometimes we see ourselves not as we are, Dr. Cooper, but how we like to be. Thank you.
Okay, I saw that as something that Dr. Cooper and Dr. Bailey might want to answer quickly. Dr. Cooper, Dr. Bailey?
And also Dr. Simmons, when she comes back on, if she comes back on, she had her hand raised. There's a 310-991-6622 with their hand raised.
Okay, let's go to them. Who is that? State your comment or question.
Hi, this is Tori, Dr. Maxey. I was going to say Dr. Brewer makes a very good point about the strategy. But one of the things that I've learned in the police advisory board meetings is that African Americans, their numbers are so low. So we really need to get on that strategy to get them in there. And we have a couple of community police officers that probably would be willing to take the second tier of the strategy after the community talks to the recruits. So we can make that happen as soon as possible, because around the world, a lot of police officers have been recruited from the South, and they're not us. So we need to hurry and make that one of our priorities.
In response to that, I recall about 1 week before the previous FBI director, Mr. Comey, got fired, he was in Los Angeles, and one of the special agents that's a fraternity brother of Admiral Brewer and myself in Sigma Pi Phi let us all know that they were recruiting specifically for Blacks, Latinos, and women to join the FBI. And they were trying to do that, and I'm sure that part of them getting rid of him was he was trying to fix those ranks. I want to go back to Dr. Cooper and Dr. Bailey with the response.
Dr. Maxey, Dr. Simmons had her hand raised for a while. Just want to make sure we get her.
Dr. Simmons?
I'm going to withhold mine at this moment. I'm going to go ahead and let Dr. Cooper and Bailey speak.
Okay. Dr. Bailey, Dr. Cooper?
Bailey, I'm unmuted. Now remind me which point this was, Randall?
He was saying that you had a lot of good information, but you spoke too fast.
I hit it a lot. I'm from Texas. It must be by way of New York, so I'll make sure I slow down.
And Dr. Cooper, he was interested in some of the things you had to say too.
Can you hear me?
Yes.
Okay. No, well, I'm just impressed that many of those assembled agree with the strategy aspect of it. You know, I think it's very important that we focus our efforts and our thinking on what outcomes we're looking for, and not on what's making us feel better right now. You know, because very often those are two divergent kinds of behaviors. It seems as if there's some general agreement about that, and I think to the extent we can rely on our intellects and not on our emotions. I mean, there's a time to come from the heart and time to come from the head. I think when you're under this kind of duress, it's got to be coming from the head.
Good. Before we go, I'm going to give a lot of credit to what Megan Williams is saying, that she feels and believes that we're going to come out of this good. And I am reminded of the fact that when the Israelites were in Egypt, they came out free, they came out millionaires, they came out successful. And we're in much the same condition, that if we use the appropriate strategy, use our intellect and use our faith, that we can have a similar outcome. And I think that is extremely important. I'd like to call on Bishop Pate to take us out in prayer. Again, I don't mean take us out in a bad way, but dismiss us in a way that we do have hope, and we pray that we are strategic and use good common sense and not just emotion in our response to these things that are bothering us health-wise. But before I do that, I have a very good friend, I hope he's still on, that I met in the early 60s. And he is one of the founders of the Newport Jazz Festival, of the Cool Jazz Festival. And he's been my friend all these years. I met him when Cincinnati has its first jazz festival. And I was able to visit him and his wife in Boca Raton a few months ago. Is John Suduka still on? Is John Suduka still on? Okay. If he's not, I'm going to ask, hearing no other urgent comments or questions, to give us benediction.
Yes, I thank everyone that's on the line, and especially Dr. Maxey. I want to do just a short little praise report. About 15 minutes ago, hundreds of young people here at our state capitol, they came out. The meeting was organized, young and Black. It was organized by a young Black teenager, 17 years old. And they end up at the end, the mayor was praying, and all of it. And we have a Black spirit-filled mayor here in town. And I know personally, and what's so beautiful today, in the Protestant churches across America today is Pentecost Sunday. And the people bowed and prayed and sought God for unity and victory. And I just want to agree with my dear sister Megan, because I believe all things are going to work together for the good. And I want to say in the 1890s, Murphy Foster, the first passed laws that created the bigotry and racism, amen, in this nation, and states in the South followed it. And it's fitting that in Baton Rouge, this first march that came out was a march of unity. And in the midst of crisis, always give birth to the new liberators. I believe that we as older people are going to be able to turn it over to a generation that's going to be strong and know how to take the evil and make it good. Now, Father, in the mighty name of Jesus, I thank you for every man, woman on this line. I thank you for all the wisdom that has been accumulated of the ages that are in them. I thank you for the experiences, Lord God, of their lives through the civil rights movement of the 40s and 50s and 60s. And I thank you for the success, Lord, of the last century. And now, Lord God, they will be the counsel to this generation of young people. We pray for all that have lost the lives of their children, murdered, concerning, Lord God, these departments of wickedness that was created through seduction and deception of authority. And we thank you that we are coming to a place of taking the knowledge and the experiences of 2 to 3 generations and going to bring it together. And the fulfillment of the prophecy concerning why you allowed the slavery to take place in this nation, that you would raise up the mighty people of African descent, not only to rebuild America in this last days of her existence, but be a voice to the entire world. And I thank you that you have given Dr. Maxey the strength, the wisdom to hold on and to gather up friends and friends up friends in this day. And that, Lord, this Black, Lord God, Health Trust will be the instrument to bring other organizations together to create a wealthy economy. I thank you that the ignorance and the oppression of the oppressor that created sickness and disease in our community, that caused all of this death that has taken place, not only in this attack of this virus, but over the years because of poverty, because wherever poverty is violence. But you would use him and his team and this organization to take the very sickness and create the medicine and create the wealth to feed the hungry, clothe the naked, create, Lord God, a righteous economy that we will not need the government, but we'll stand on our own and loving of ourselves and touch this young generation of lonely young people that never been loved, been looked over, never cared for. And Lord, I thank you now. Keep all of us strong, and that we'll be able to identify these young leaders that's coming forth, the wisdom of the old and the strength of the young together to bring goodness to the land. In Jesus' name. Thank you now for the Black Health Trust Foundation.
Amen.
Amen. Thank you, Bishop. Thanks, everybody, for participating. Thank you, Dr. Cooper, Dr. Simmons, and Dr. Bailey. I appreciate you. And Dr. Simmons, you are a doctor, you're a teacher. Have a good day,
Yeah.
everybody. Thank you.
Thanks, Dr. Maxey.
Good job. Enjoyed it.
Thanks,
See ya.
everybody.
Thank you so much. Amen.
Thanks, Doc.
Thank you.
Take care, everybody. God bless you.
Bye.
Doc, give me a call when you have a moment.
God bless
Okay.
everyone. Thank you, Reverend, for the prayer. Thank you, Randall.